Sue. I'm a midwife here at the San Hospital. I work in birthing unit, and I may even see you during your labour or on the maternity ward. So I'd like to talk to you today about the variations in labour and birth. We've touched on the normals, so what if something varies from what you've already discussed in the normal part of labour and birth? I'd like to touch on premature labour, and as discussed in Module 1, when you needed to call the hospital and when we want you to call birthing unit, one of the reasons we want you to call birthing unit is if you start to have contractions that are regular, maybe painful, and they're before the 37th week of pregnancy, and if they don't stop with rest, then we want to know about it. We would probably bring you in for assessment and maybe give you medication to stop the contractions. However, if the medication doesn't stop the contractions, then you are able to birth here at the hospital between 32 and 33 weeks of your gestation of your pregnancy for a single pregnancy, or between 33 and 34 if you have a multiple pregnancy. Now, if it's before this time, then it will be discussed with you about perhaps transferring you to another tertiary hospital where your baby may be born, and in a bigger hospital where they have a NICU unit, which is a neonatal intensive care unit. Another important reason we want to know if you have any problems at home during your pregnancy is if you're experiencing any bleeding. One of the significant reasons for bleeding through your pregnancy is a condition called placenta previa, where the placenta is low-lying. It may be close or across the cervix, which is at the base of the uterus. We need to know if you experience any spotting, bleeding, or significant blood loss. Of course, if it was a large amount of blood loss, you'd be calling 000 and asking for an ambulance to transfer you to hospital. Your safest mode of delivery will be discussed with your doctor through your pregnancy, and as I said, that may change through your pregnancy as to the degree of the placenta previa and as to the mode of your delivery. I'd like to introduce my model, Olivia. She's going to be my model throughout the discussion with you today. And Olivia usually sits nicely with her head down, this way, curled up, nice little position. However, what happens if your baby's this way? It may be with its little legs up, bottom presenting, or its little feet down, and it might sit comfortably under there to the 37th week, which it may then turn. However, if your baby doesn't turn before the 37th week, you'll need to discuss with your doctor which mode is the safest form of delivery for you. Throughout your pregnancy, your blood pressure will be monitored on each visit. However, if towards the end of your pregnancy your blood pressure does rise above an abnormal level, then the discussion will be had as to whether to induce your labour. During induction of labour, it is recommended to have an epidural to keep your blood pressure at a nice safe level. And of course, this will depend on the gestation of your pregnancy and which is the safest mode of delivery at that particular time. Group B streptococcus, or also known as GBS. If you test positive, then you will need to be treated with antibiotics during your labour. GBS is an organism that approximately 30% of women carry, which is detected by low vaginal swab at 36 to 37 weeks. It is not an infection or STD. However, it needs to be treated because if the waters are broken, then there is a possible chance that the baby may have some respiratory problems after the baby's born. I have my lovely assistant Olivia with me again, because we're going to talk about slow labour. Every woman labours differently, and for every labour, for that woman, it may differ. Early or first stage of labour may be slow, and contractions continue to be irregular in length and strength. Posterior position of the baby is the baby's spine facing the mum's spine. Now this can cause the contractions to be a little bit longer be a little bit more irregular, and also give the mum backache. Strengthening the length and regularity of contractions may be recommended in a discussion with the mum to progress the labour. This is also called augmentation of labour, and that may strengthen the contractions by either breaking the waters or an oxytocin drip, or both combined.